you in the SSTC course we have for Botox injections
Can we
tomorrow.
have the volume?
So let's just get right into it. We're going to talk about hyaluronic acid gel filler, some techniques, tips, and tricks which can help you getting started with this procedure. So what we're going to cover in this talk is we're going to talk about orbitofacial aging, how it happens. We're going to talk about some general principles when it comes to filler injections. And I'm going to talk about three specific areas that I really like injecting and I think that really give you the biggest bang for your buck. All right. So, whenever we talk about orbitofacial aging, we tend to have more of a 2D concept, or even when patients come to us, everyone's basically talking about how they have excess skin in their eyelids, or uh, how the skin is sagging in the neck. But what we need to understand that the aging that occurs is not two-dimensional, it's three-dimensional. So there's a lot of fat pads all over the face which give it the youthful look. And essentially, a lot of aging that happens is because of the deflation and descent of these fat pads. So when, we have to change the way we think about these concepts. Earlier, what we used to talk about excessive laxity of the upper eyelid skin, it's not as much laxity of the upper eyelid skin as it is the deflation of the eyebrow fat pad. Similarly, there is deflation and descent of your mid-face fat pads. And essentially with age and gravity, what the skin is trying to do, it is trying to combat the activity of the muscles. So once we look at it differently, I think we will be able to treat these aging changes differently as well. So some general principles that I really like to keep in mind for filler placement. And as it is with any aesthetic treatment, it goes through waves of different types of trends and fads that happen. And now, we're in the age of undetectable aesthetic procedures, which has always been my own natural, preferred aesthetic. Because the idea is that you want to enhance the features that are already present in the patient that's coming to you. So less is more. You want to make subtle changes which take care of these aging changes that have happened and not do anything drastic. And so when you want to apply this principle of less is more, it's very important to understand how lights and shadows come into play. So if you look at the face and if you look at how the light is projected on the face, there are certain areas that tend to project more as shadows. So if you have the tear trough, because you have the eye, so there is the shadow of the eye. So this tends to look darker, or the temporal hollow. So once we start looking at these things more carefully, we'll understand that addressing just these areas where the light tends to form a shadow will give us the best result when we look at injectable treatments. So now coming to area-specific filler injection techniques, I'm going to talk about three specific areas that I really like injecting. The first one is the brow fat pad. So if you look at the anatomy of the brow fat pad, we're all ophthalmologists here. We know that you have the roof superiorly and you have the SOOF inferiorly. So the roof is the retroorbicularis oculi fat pad, and this is what gives our eyebrow the nice, full look, which is so typical of a youthful eyebrow. So when we look at it, sometimes we tend to confuse this fullness, with the eyebrow hairs. We tend to confuse the eyebrow hairs with the eyebrow, which is not the case. As decades change, the way you style your eyebrows change. So in the early 2000s, it was very fashionable to have thin eyebrows. Now it's fashionable to have thicker eyebrows. Some women also get eyebrows tattooed. So you have to understand that when you look at restoring the eyebrow fat pad, you're looking at the fat. You're not looking at the hairs or the position of the eyebrow as such. So it's important to look at that. And what happens with age is that there is deflation of this fat pad and there is descent, which leads to, what is one of the common aging changes in this area. So a lot of these patients will come to you with the complaints of saying that I have excessive skin. Now you need to understand that yes, excessive skin might happen because of the deflation, but the majority of the main factor which is playing a role in aging in this area is the deflation of this fat pad that you have here. And in a sense, once you understand that it's the deflation which is causing the aging, you would want to re-inflate this fat pad rather than taking a lot of excessive skin away. So now where to inject? I think in this area, you have to understand that you want to kind of reinflate this fat pad that you have here. I like to go laterally. I don't like to inject very medially in these cases because you have the neurovascular bundle and that's a high risk area for occlusion. But in the lateral area, you're pretty safe. So you just want to bunch it up and kind of go in laterally and re-inflate the brow fat pad, which gives you like a really good result. You can take care of the superior sulcus hollows and really restores a good sort of voluminous look in that area, which restores the youthful look. The second area that I'm going to talk about, very common, um, most of the ophthalmologists sort of want to do the tear trough filler. So let's talk about the anatomy. What are the changes that we see in this area? Now, when you look at the tear trough anatomy, there's a couple of structures that are important. You need to look at the orbital retaining ligament, which I would say is the most important area, which kind of forms the barrier between the orbital fat prolapse, which is superior to it, and you have the malar fat pad, which is below it. And essentially what happens is that there's thinning of the tissue above the orbital retaining ligament, which causes a trough in this area, which, looks very obvious and is what most patients come for. So when you look at the tear trough, it is this orbital retaining ligament, which is present inferiorly, but it kind of extends all over the eye, and you have that hollowing all over, 360 in the face as the face ages, but we do notice it more inferiorly. And in this area also, you need to understand that there's two troughs. One is the septal confluence hollow, which is superior, which is just below the orbicularis, and then you have the zygomatic hollow, which is below the orbital fat prolapse. So when we're trying to fill the tear trough, we're trying to fill the zygomatic hollow, which is inferior to the orbital fat prolapse, which is just over the orbital retaining ligament. Now, where to inject? Again, there's a lot of conversation about whether you want to use a needle or whether you want to use a cannula. Regardless of whatever method you're using to inject, I think what is important to understand that you want to be injecting in the preseptal space, because once you cross the septum, you're injecting this product into the orbit, and that you're wasting product like that. So you want to be injecting in the preseptal space. So in order to sort of fill up that trough that is there, and how I like to do is I usually like to use the needle for this, and I like to go all over the orbital retaining ligament, starting from the medial to the lateral area, injecting in small aliquots, so you can see that inflation happening right as you do it, and always underfill rather than overfill is what I would say, because less is more in this area. You can always do more if you want later, but doing a lot and then dissolving it is just something that we should not be doing. And tear trough filler, the good thing about it is that it lasts for about anywhere between 18 months to 2 years. Great results, and excellent option for people with hollowing in this area, especially younger people who have good skin quality. And the last area I'm going to talk about is the temporal fossa. Again, something I think which we ignore when we look at aging changes of the upper face. But I think it's a great area. It really gives you a great result if you learn to identify and inject it properly. So understanding where the temporal fossa is, obviously it lies over the temporal bone, and going from the skin to the bone, you have the skin, the subcutaneous tissue, you have the deep temporalis fascia, the temporalis muscle, and you have the bone. So what happens with age is that there is resorption of the bone in this area, and there's also deflation of the subcutaneous fat, which leads to this hollowing that happens with age, that becomes very prominent. If you look at this woman, she's got these hollows, which is something that you might not look at one go, but it overall, when you're assessing the face in general, it makes a huge difference. So where do we want to be injecting in these patients? You want to ideally be above the deep temporalis fascia, but when you are injecting, it's difficult to determine, when you're crossing the subcutaneous layer, when you've crossed the deep temporalis fascia. And one of the thing one of the things to be careful about is that you have the neurovascular bundle behind it. So you don't want to be injecting into that. So one of the easier ways of injecting in this region is going straight down to the bone. Once you're going straight down to the bone, you know that you're not hitting any neurovascular bundle, and then you just kind of, fill up over there, and you can feel the whole layer lifting up, and it has great results. If you look at the before and after, it's a very subtle change. It's not something that's going to be very obvious to the eye, but that's what we want. It overall gives a fairly youthful look, and quite popular. So to summarize, a lot of the upper and mid face aging, it relates to the loss of your subcutaneous and deep fat pads. There is deflation of these fat pads, there's atrophy of this fat, And it's important to understand how lights and shadows play a role and in enhancing your looks, and also in terms of enhancing what aging changes there might be there. Replacing volume is a very powerful tool for facial rejuvenation, and I hope this was helpful. I'm hoping to see a lot of you at the course for Botox tomorrow, and thank you so much for your time and attention.